We are a community health system and have been using ECQMs through our EHR and reliably getting a small positive MIPS adjustment. That is, until this most recent reporting period when we ended up in the penalty range. How do you recommend we get ourselves back to a positive number again?
Great question, John. I think you're in good company. A lot of good organizations are finding themselves with negative MIPS adjustments. MIPS has been ramping up since its onset in 2017, gradually reducing the opportunity for extra or bonus points and bringing all of the performance categories up to their most demanding levels. Now, a lot of that phase in dynamic was actually hidden during the COVID years when there was COVID forgiveness built into 4 years of submissions. That phase in continued invisibly behind the scenes, and we didn't get a pass on that when it came back. When NIPS returned, it came back at its full ramped up dynamics when the pandemic officially ended. Now, 2024 was the first full year, the first full performance year without substantial pandemic forgiveness. 2026 will be the first year that we experience the full weight of post pandemic adjustments to our Medicare payments. Now, the first point to realize is that no matter how well you do, the system is designed to give roughly half of the participants a negative adjustment and give the money retained from those negative adjustments to the providers in the positive adjustment range. There's a competitive nature to this. Only half of providers typically will be getting a negative adjustment and half a positive adjustment. Now, there are some oddities in the math of the grading curve that render this not completely true, but conceptually, that is how it's intended to work. Half of us will experience a negative adjustment that will fund the positive adjustments experienced by the other half. Now, you not only have to do well on all four performance categories, you have to be in the upper 50th percentile of performance when compared to your peers. You can't afford to neglect any performance category. Now, perfect MIPS score is 100. Contributing to that 100 points are four performance categories. 30 points come from a perfect quality score. 30 points can come from a perfect cost score. 25 points can come from a perfect EHR utilization score. They call that promoting interoperability. And 15 points from a perfect improvement activity score or practice improvement process. There are a lot of special exceptions to these basic rules, but overall, this is how the program works, and mastering your knowledge of the basics should help you push toward a positive adjustment more reliably every year. Now, Medicare has set a target of 75 out of those 100 possible points to be the performance threshold. It's the score that, at least in one index year, and typically most, was the median score nationwide. Half of submitters are expected to get a score below 75. Half of submitters are expected to get a score above 75. So 75 is what they call the performance threshold, and that defined you're getting a positive or negative adjustment. A total miss in either cost or quality gets you completely out of the running for positive adjustment. 30 points out of 100, you only get 70. You can't hit that 75 points. A total miss in EHR use means you can at best have a neutral adjustment. It leaves you a 75, so you do perfectly on all the other three performance categories, you can be neutral. Practice improvement points should be a solid foundation on which you can build the rest of your submission. Those 15 points won't lose that incentive range for you, but again, they can be a good, solid foundation that you can afford a little miss on some of the other categories and still make the incentive range.